Hi, I'm Kristen, one of the nurses with the Home Infusion Pharmacy, here today to show you how to disconnect your chemo when the infusion is complete. You want to make sure you have a clean work surface to set up your supplies on, so you want to clean with a paper towel and spray cleaner or a disinfectant wipe. Then you can set out your supplies. We have our chemo disconnect kit, 2 saline flushes, and our heparin flush, which is yellow. Then you're going to make sure you wash your hands with soap and water and dry with a paper towel, or you can use alcohol hand gel. You want to clean your hands before you get started on the disconnect. First, we're going to open up our kit and put on the chemo gloves. There are 2 pair in here. Next, we're going to check our chemo and make sure that it infused all the way. This is what the device looks like when it's empty. So this is what it should look like before you disconnect it. And you also want to make sure that it's been connected for the right amount of hours. We can tell that it's empty, so we're ready to close our clamp on the medication tubing. And we're going to close the clamp on the port tubing. You just squeeze it to close it. Next, we're going to remove the flow restrictor that's been taped against the body. Now we can see the connection between the medication and the port needle tubing. So we're just going to twist to remove that. The empty chemo device goes into the chemo waste bucket. We can open up our wrappers. So that we have everything ready. Next, we're going to take an alcohol pad out of the kit, rip it open, and we're going to clean the end of the needle for 15 seconds. You want to just twist it and rub it around on the end, on the flat part and on the sides. Make sure it's really clean. While that's drying, you're going to take your saline flush, take the cap off, pull down on the plunger to break the seal, and then slowly push up to push the air out and see a drop of fluid come out the top. Next, you're going to push and twist the syringe onto the end of the needle. Open up your clamp, and then you're going to flush with a push-pause technique. Next, we're going to close the clamp. Then we're going to untwist the syringe and put it in the waste bucket. We're going to take a new alcohol pad and clean the end. So each time you connect to the needle, we're going to make sure we clean it with a new alcohol pad for 15 seconds. And then we're going to let it dry. And while it's drying, we're going to get our flush ready. We're going to pull down on the plunger to break the seal and then slowly push up to get the air out of the syringe. Next, we're going to push and twist the syringe onto the end of the needle. Open up our clamp and flush again with a push-pause technique. Close the clamp and disconnect the empty syringe. Lastly, we're going to do the heparin after we clean. The heparin always goes in last. And it works the same way as the saline. We're going to pull down, break the seal, slowly push the air out, push and twist the syringe on, open up our clamp, and flush with a push-pause technique. And then we're going to close our clamp, take off the syringe, put it in the bucket. So now the port is flushed. We're ready to take off the dressing and remove the needle from the port. You're just going to carefully remove the dressing. You can apply counter pressure against the skin to help it lift up. Now you can see that there are two clear tabs against the chest and then these yellow wings. We're going to fold the yellow wings up and use one hand to push against the chest on the clear tabs. And with your other hand, you're going to take the folded yellow wings and pull straight out. 1, 2, 3. When you hear a click, you'll know that the needle is removed from the port. This goes right into the sharps bucket. Sometimes you may see a drop of blood on the port site. That's normal. You have a piece of gauze in your kit and you can just apply pressure until the bleeding stops. Otherwise, you can take the little piece of Tegaderm out of the kit and cover the site with the dressing. You can leave this on for a little while, but you definitely want to remove it within 24 hours or sooner if it gets wet. Okay. You're going to remove your gloves and make sure these go in the chemo bucket. All these other wrappers can go in the trash. You're going to put the cover on your chemo bucket and put this away up in a closet or in a garage away from kids and pets until you need it for the next treatment. Chemo should be disconnected and you can always call your nursing agency or the pharmacy or the nurse line on your instruction sheet if you have any questions or problems.